Hi, my name is Dr. Bertsch. I'm a chiropractor at Team Healthcare Clinic, and this is Dr. Starr. He's a board-certified chiropractic neurologist, and I wanted to talk with Dr. Starr a little bit about a term that you may be hearing more of. Certainly we're hearing a lot about it in the literature, and it's neuroinflammation. Dr. Starr, tell me what's going on. What's the buzz around that?
Yeah, so neuroinflammation is becoming more and more of a hot topic, and big reason being is a lot of times patients are complaining about things like brain fog, slow mental processing speed, having a hard time kind of being on the top of their game. And what's interesting is the brain doesn't necessarily experience pain like other aspects of our body. And so the way that inflammation is exhibited within the brain is through these symptoms, such as brain fog. And the other interesting thing in regards to what the research is showing us is that even though about 10% of the brain is made up of the actual neurons or brain cells that oftentimes we're focusing on with our therapies and rehab, the other 90% of the brain is made up of what are called glial cells. And these glial cells are actually immune tissue. And so when we have a direct head injury or concussion, but even something that could be more long-standing, and we see this a lot even with kids with ADD, ADHD, and autism, there's neuroinflammation in the brain as a result of these immune cells that become more and more activated.
So are you saying that someone could have ongoing inflammation even though they had a trauma years ago? They could still have low-level?
Absolutely.
Tell me about that.
Absolutely. So a lot of times with traumatic brain injuries or concussions, even though that may have been something 5-10 years in the past, they noticed that even their brain fog was something that started maybe a little bit after that and has worsened since that time period. And so it's quite frequently that we start to piece through someone's history and start questioning things with them in their past, and we'll actually kind of bring to the surface a past head injury or maybe a car accident or something that set this event off. And there's different types of neuroinflammation. There can be more transient that comes and goes. We can have more chronic inflammation, and there can be even worse than that as well. And so it's important that we catch these things as soon as we can, because the sooner we can catch that, the easier it is to make changes in regards to someone's brain health.
Well, it's an exciting time because I know as we have the advancing baby boomers, there's a lot more attention and concern with poor memory, brain fog, dementia, and we're finding that there's lots that can be done, and it starts sometimes with just getting that inflammation regulated. So if you have an interest in having that further evaluated, I'd invite you to see Dr. Starr. He's our expert on that, and I think you're going to find he's quite thorough and he's very innovative.